Okay, you want to know something really annoying? I did not realize that my battery ran out, so I finished the entire lecture and I went to get it and found out the battery ran out, so very annoying, but I apologize that this is going to have to be in 2 parts now. And I noticed that the video stopped right here when I was talking about osteomyelitis and how hard it is to treat. And so your role as a nurse is to, one, identify the patients who are at risk for it. The patient's probably going to have to be in the hospital on IV antibiotics because you're going to try to prevent this infection from getting worse. It can lead to bone necrosis, inflammation, an abscess can form in there. So you want to prevent it. So you identify any people with compound fractures, surgeries, pins that are going in there to hold a broken bone in place like that. You want to prevent infection from getting in there. So apparently I didn't tell you about this either. Your patients who have diabetes, peripheral arterial disease, PVOD, peripheral vascular occlusive disease, the blood vessels that are supplying blood down to the tissues, those can start causing ischemia and tissue death. So it can cause little fistulas and opening in the skin, which allows a pathway for that bacteria to creep up inside the skin and land in the bone and lead to infections up in the bone. So your patients who have diabetes, peripheral vascular disease, you also need to watch for things like this, especially if they start getting complaining of pain, fevers, white blood cell counts. You kind of probably need to get an x-ray and see if perhaps they've got an osteomyelitis going on. It could also be just a cellulitis. See how there's a little bit of redness going around in here and tracking down in here? The bacteria that is tracked up in there is probably also creating a cellulitis, which is an infection in the tissues. And so you really want to be vigilant to identify this, because if you don't get it under control, this person could lose their entire foot. So that's osteomyelitis. I wanted to talk a little bit about the bone cancers. Primary bone cancer is not very common. It's really, really rare if somebody has a primary bone cancer. The one cancer that you kind of need to be a little bit aware of is something called an osteoclastoma, and that's not malignant. An osteoclastoma is a giant cell tumor. It can end up in the bones, and it kind of creates this like soap bubble kind of effect. You can see it on x-ray. There's one right here. This is the tib fib. This is the fibula, and you can see there's an osteoclast right here. There's an osteoclast, the same one right here. This is in the hand, and there's a big osteoclast right here. It is painful. Anything in the bones are painful. And it's not malignant, but if it's not treated, it can become malignant. So typically when an osteoclast is found, sometimes they'll do radiation, sometimes they'll surgically take it out. Like I said, they'll treat symptoms. It's not yet malignant, but they do watch it because these are the ones that can convert and become malignant. So the primary thing that you're going to take care of as a nurse is metastatic bone cancer, and that is a problem. Lots of cancers, breast cancer, colon cancer, liver cancer, love to mets to the bone. And the way that they'll find it, it shows up kind of like this in the bone, not quite that big looking. They'll take a piece of it, and it'll actually be cells from breast cancer, liver cancer, colon cancer. It's not primary bone. That's how they know the difference. And it's very painful. And unfortunately, it's usually one of the last places that a malignancy will go. So people are in their last stages of fighting a malignancy, and then it lands in the bones, and then their pain level significantly increases because it hurts when it gets to the bone. So that's what we deal with bone cancers. Paget's disease is not a common orthopedic issue, but it's enough common that you're going to need to at least have heard about what this disease is. Paget's disease can be mild. Some patients have no symptoms at all. A classic symptom of it is an enlarged skull. The head gets really big, and the long bones tend to bow out like this. And what's going on with Paget's disease is there's rapid bone turnover. So the bone is turning over way too fast, and there's lots of vascularization going to it, but they're very weak. The bones are very weak. And what happens is because of this rapid bone turnover, the bones are getting rid of calcium, so the blood levels of calcium are high, so the patient is going to have signs and symptoms of hypercalcemia. They can also develop kidney stones because of all that excess calcium can lead to stone formation in the kidneys. That can be painful. So that's Paget's disease. You may not ever see it in your practice, but you might. Now you'll know what it is, and you'll know what to do about it on NCLEX. Carpal tunnel, we're going to talk a little bit more about these also in the next chapter. I just want to make you aware of this because this is a very common disorder. Carpal tunnel is an inflammation of the volar carpal ligament that goes right across the hand right here, and there you've got a median nerve that goes right through this hand like that. And people who use their hands a lot repetitively, like keyboardists who are on their keyboard a lot, data entry people, like grocery store workers that are constantly going like this, what happens is it causes irritation and inflammation to this ligament here, and it starts swelling up and compresses this median nerve and causes pain, numbness, tingling in the fingers. So rest is ideal, but if it's somebody's livelihood, that's hard to do. So some patients will wear braces, they will ice it at night, non-steroidals like Motrin helps. But that's carpal tunnels. It's also similar to Raynaud's syndrome. Raynaud's is very similar because there is an involvement of this median nerve, and when those fingers get cold and they vasoconstrict, it almost acts like frostbite. People with Raynaud's have the same kind of thing going on. It's actually quite similar to carpal tunnels, but their fingers will get white and really, really painful, especially if they're cold. So the treatment for Raynaud's is to keep those hands nice and warm so that the vessels stay dilated. Gout, your book also doesn't talk about gout, but I just wanted to point it out to you guys because it's really common. This is a picture of gout, severe. This is severe gout in the hands. But it's most commonly seen in the great toes, the big toes of the feet. And gout is just formation of crystals in the joints, and it's really painful. It's like putting sandpaper in somebody's joints. That really hurts. Sometimes your patients who are on antidiuretics can develop gout. If they do, you need to switch diuretics or antihypertensives to something that's not a diuretic that can lead to gout. Osteoarthritis. If you will recall when we were talking about the rheumatoid disorders and the autoimmune disorders, your book lumps osteoarthritis in with the autoimmune disorders, but it's not an autoimmune disorder. So I want you to know about osteoarthritis. I'm not going to test you on it because it's not technically in chapter 42 or 43, but 100% you're going to need to know about this because it's a really, really common disorder that you're going to see in your practice. So with osteoarthritis, this is an example of a normal bone-to-bone with the joint. And you've got a nice wide space between these normal bones. You've got some cartilage on both sides, both the distal and the proximal ends of the bone. You've got your synovium, your synovial fluid, all in this joint capsule. What happens in osteoarthritis, and usually this will occur over time. Now some children have arthritis, but that's not as common. But they can. Kids can have it, but it's way, way, way more common in age 50 and older. And the reason is because this disorder is very closely related to overuse or excessive use. So your football players, tennis players, track, so all of you athletes out there, you are very high risk for developing osteoarthritis, especially those joints that have been pounded on a lot. So your knees, hips, shoulders, football players, hockey players, runners, lacrosse, anybody who's pounding those joints, been getting hit in those joints, what happens is there's a destruction of the joint. So you keep pounding, 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 and eventually this cartilage gets thinner and thinner. And then what happens as it advances is the bone actually starts remodeling and developing some articular bone cysts. This becomes very painful. So one, you want to prevent it. It's very hard to prevent because we want people to be active as long as they can. But once it does start developing, really probably need to stop whatever is causing the impact. So if a person was a runner or something like that, probably time to switch to biking or swimming or something that doesn't have that constant pounding or that jarring, which can lead to this. If these get significant enough and it's painful, these are your patients that have to go for joint replacements. They go for knee replacements, hip replacements, shoulder replacements. And we're going to talk a little bit about the replacements next time. But this is extremely painful and ultimately destruction of the joint, so that the person can't use the joint anymore. So they're starting to use walkers and canes, and that's not good either. Then their body gets all out of alignment. So that's osteoarthritis. The treatment for osteoarthritis is to rest. So you would tell your patient if you're doing something and then afterwards it hurts or it's swelling or you've got edema in that joint, then you rest. You stop doing that activity. You can do rest, compress ice. They can put an ACE wrap on it, put some ice on it. I'm sure all you athletes out there have had like a joint injury that, you know, that's gonna put you at a high risk for arthritis later in life. You can go back and forth between the heat and cold applications. Sometimes physical therapy is helpful because if you can strengthen the muscles and the ligaments around the joint, it kind of helps keep that joint intact a little bit. And then by drug therapy, I mean like the NSAIDs, occasionally steroids just to get the inflammation down, but you don't want a person on steroids for very long. The sprains and strains, same thing, the rest, ice, compress, and elevate. And by compress, I mean you're going to put a patient in a splint. And by elevate, I mean higher than the level of the heart. So if you know the patient can lay down on the couch, you would just elevate that up on some pillows. And then you're not going to use it for a week to 10 days. And then after the inflammation is down, the pain is subsiding, then you might have to start physical therapy, but you're not going to start physical therapy within the first week or so after a sprain or a strain injury. And that's the same thing with low back pain like we were talking about earlier. So I can't remember if on part 1 I told you about how to identify the skeleton, the parts of the skeleton, like with the proximal, medial, distal. I'm going to recap really super quick. Each bone in the skeletal system will start over with identification based on the location of the core. So for example, your humerus right here, up here is my proximal humerus. Proximal is closest to the core, medial humerus, and distal. And then you would repeat that with your ulnar and radial bones. So this is proximal, medial, distal, and you started over with all of your hand bones is proximal, medial, distal. And that's true with every bone, like in your femur. The proximal femur is the one closest to your hip, and then the distal femur is closest to your knee. So I just wanted you to know, so when you're talking about proximal distal, that it's all centered around the core. You need to use that because you need to start using proper medical language. When you're talking to other medical professionals, you don't use that language when you're talking to patients or families. So I think that's it. And if I forgot to tell you something because my video got cut off, hopefully I'll remember it in class. I'll go back and watch and make sure I didn't forget anything. So that's it. Okay.